Well, it's been a couple of weeks since we last checked in and got an update from Dr. Pogue on information about the coronavirus and what it's doing right now. And I wanted to ask him some questions for where we are at currently. So thanks for joining me again. Glad
Yeah,
you're
sure thing.
here. I would just like to know, where are we at right now? You've got more up-to-date information than most of us do. What are we looking at for the state of the coronavirus in the St. Louis area right now?
Yes, thanks for having me on. So the coronavirus is continuing to progress over the last couple of weeks since you and I last talked. However, the rate of that progression has slowed way down. We've seen the number of cases starting to flatten out. The number of people in the hospitals in all of St. Louis and the general area have started to level out. And so it's very encouraging data. We should be getting close to the peak where we have the maximum number of infections, and then that hopefully will go down if we continue our discipline. We have about 465 or so patients that are in all of the hospitals surrounding St. Louis. And that's only gone up by a handful in the last several days. And so while we're not quite at peak, we haven't seen it start to drop on a consistent basis yet. We're very, very close. And that's very encouraging that we've kind of seen the worst of it so far.
So we're very close to the peak of coronavirus infections or hospitalizations, maybe I should say. Well, I guess those go hand in hand, but we're nowhere near our peak hospital capacity. Is that right?
That's right, actually. And so when this all started, people were very, very worried that we would have a large spike in infections in the St. Louis region, that the hospitals could be overrun with folks who were so sick that they needed hospital care, but wouldn't have the capacity or the beds for them. Thankfully, that's not happened, and we've been able to maintain full services to everybody who needs it all the way through. And BJC and Mercy and SSM and St. Luke's have all been working together very tightly, and I think that's helped as we've been able to make sure that if a patient is sick, no matter where they started in that healthcare network, that they can always get the right bed and get the right level of care that they need. And so it's been very encouraging. We've been able to help everybody.
This is really great news for us because it means that our trajectory is not going to be anything like New York. At first, it kind of looked like it was headed that way, right?
It did. It did. We early on, St. Louis was on a steep, what we'll call an exponential curve in terms of the number of new cases that were happening every day and how fast the number of cases doubled every day that went on. That curve was very steep coming out, and then it really flattened out as we got in towards the first week of April, and it's flattened even more here since Easter, and that's been really, really encouraging.
Do you have any idea as to why it started to flatten out? Why didn't it just continue to rise exponentially as it did in other places?
Well, thanks go to all of you who decided to use more gas in your lawnmower over the last 2 weeks than you did in your car, and stay home, and stay away from other people. I think the social distancing factors have been tremendous in terms of helping out and keeping the virus from hopping person to person. When you just think about kind of the what we expected mathematically and what actually happened, it's been a real blessing from God that we've been able to calm that down and not had the rapid rate of rise. So we're not done with it yet. It's so tempting when we've all been cooped up in our houses to be ready to get out there and socialize again, or head back to work, or do those things that we want to do. We just need to wait a few more weeks and be diligent about this, so that we really can get the virus out of our community and let that thing die down. And once it does, then we'll all get back together and it'll be fun. But if we pull the trigger too soon, then we can have more problems coming our way. And we don't want to start this all over again if we have another surge. So
yeah, that's my next question is, what is our prognosis for the future? So let's say that we've done a great job with the stay-at-home restrictions and we're not going to have the same issues here that we have had elsewhere. If we don't continue that, don't we just run the risk of this thing flaring up again? I mean, how long are we going to have to keep doing this?
We do, and I'll share a little graph with you if I could. So I'll share a few pictures around what's happening in St. Louis right now, and what we need to watch out for as we get into recovery. So this graph shows all of the major cities in the United States and where St. Louis falls in terms of the number of cases and the rate of new cases over time. Please note that because this way this graph is constructed, it'll never go down. This is simply a total number of the cumulative cases that have happened so far. And so you can see that St. Louis started out very steep in the left side of the graph coming up, and then has really, really flattened out. And so while we are about the same as Seattle in terms of their case rate and overall rate of new cases, we are worse than Kansas City, which is at the bottom there. And then obviously we're much better than New York and Albany and Bridgeport, Connecticut, and some of the East Coast cities that have had real troubles. This is a graph of all of the absolute cases in each county around St. Louis. And so you can see the darker areas show more COVID cases up in the northern regions of St. Louis County, and actually a few important cells there to the west in Chesterfield and in Baldwin, which is close to our church. And then lighter areas indicate that there are fewer cases in those counties. This is not a percentage of the population, it's simply an absolute number of cases in each county. Now, the one thing I wanted to show us, to remind us about being vigilant as we do this is a graph that talks about what happened between Philadelphia and St. Louis in the 1918 flu pandemic that everyone's been talking about so much over the last several weeks. You can see in Philadelphia, which is in the green line, they were slow to start social distancing and closing the churches and other things, and they had a huge spike in number of cases and ended up with almost 800 deaths over the course of about 2 months there in Philadelphia. St. Louis during the same time was very quick to close churches and schools and other community gathering areas. And you can see a couple things. One is our overall death rate was lower. We had about half the deaths that Philadelphia did, so preservation of life was better in St. Louis. But look how long it took. Whereas Philadelphia really had a big spike, but it was over in about 6 weeks to 7 weeks. St. Louis, you can see, lasted several months where we had low levels of cases for a long time. And initially, you'll see that about November 23rd, we hit something of a low point, and it would have looked on the curve like the cases were going down and the whole thing was over. But then look at that spike into middle of December. And so if you go back to your community gatherings too soon, you could end up with a spike at the end. And St. Louis had one of those in December of 1918. And then finally got the message, everybody shut it down again, and then finally everything left. And you can see by the first of the year, most of the flu in that case was gone. But this is the same pattern that we're seeing now, where we are on a nice, soft, flat curve so far, and it's been good. And I expect that we're going to start to see some decreasing cases fairly soon. We need to stay vigilant, and if we can stay vigilant and stay separated for a little while longer, then we'll avoid that second bump there that would cause us to have to do this all over again and stay away from everything and everybody longer than anybody wants to.
So in looking at these two charts, one has to ask the question, why would we want the lower flattened curve over the spike? Because in the city of Philadelphia, back 100 years ago, their cases of the flu were over very quickly. St. Louis was drawn out over several months, had that bump at the end. I didn't see a total number of overall deaths listed there. So which one was better? Which one was worse, to get it over with quickly and have that quick spike like Philadelphia did, or to stretch it out over that long period of time like St. Louis? Why would we want the lower curve?
Yeah, it depends on what you value. And so the downside of Philadelphia's big spike was that almost 800 people died in that spike. Their medical systems were overwhelmed. They really couldn't support people the way they needed to be. They didn't have any of the modern medicine type instruments that we have today. And so almost 800 people died during that big spike in Philadelphia. St. Louis, though, their time period was much more elongated and they had to deal with the flu for a longer period of time. They had less than half of the number of people die during their pandemic. So St. Louis was hailed at the time and actually has been praised since for its quick action, which saved almost 400 lives more than Philadelphia during the same pandemic. And so it really comes down to loss of life and how we value people. We value people, then we fight hard to make sure that people are protected and that as few folks die of this as humanly possible.
So what does it look like for the next several weeks for us? When can we start having church again? What are those gatherings going to look like, do you think?
Yeah, so we've learned from Seattle and some other places that have gone through the cycle ahead of us that we need usually about 2.5 full cycles after the virus to really be in good shape and to have it leave the community without one of those second bumps at the end. And the cycle for this virus is about 2 weeks long. It's about 14 days. So people are talking about 4 to 5 weeks out from the peak as being the time where we can reopen businesses and the economy and other kinds of things. And I think what you'll find is that it's all staged. It's going to be, we have only essential services right now. There'll be another ring that goes out from there that allows some other types of businesses to resume, particularly businesses in which there's not a lot of traffic or congregating of people, businesses that are also vitally important to the economy, but maybe not as exclusive as what we had right now with food and healthcare and police and fire being some of the industries that are allowed to be open now. And so we'll see that gradually open step by step. Church, I imagine, is going to be something that about June 1st or so we'll be talking about, and we'll see how it goes. It's like anything else; the patterns will happen the way they do. We'll measure those and follow them closely, and when it looks like we have the all clear, both from an official standpoint, but also from a medical standpoint and a healthcare standpoint, then we can all get back together and celebrate together.
Yeah, and one of the things people watching should know is that we've been planning for what reopening looks like and the stages that we would go through as a church. A lot of that is dependent, of course, on the regulations that the government has in place and the guidelines that they have for us. And so we will be reacting to that to some extent, but
Mm-hmm.
we may have to have a staged reopening just as the community and the country in general will have a staged reopening. And we just don't know exactly what that will look like. I mean, probably we're looking at still having some kind of social distancing, right? I imagine. And then we might have some gathering restrictions, I would think, as a part of those stages where we maybe couldn't have all of us together at one time. Do you think that might be how this goes?
Yeah, and it's going to be it's going to be a bit frustrating because the one thing we most want to do, which is gather together as a large body in the auditorium and celebrate a worship service all together and pack the place out. That's what we can do last. So that'll be last on the list of things we're allowed to do. So if we can all just be patient, it'll happen. We'll be back together again, but it'll be some time before we're allowed to do that. And we, of course, we care about our congregation as much as we care about everybody else, and we wouldn't want to put anybody in a position where they could be harmed as part of our gathering together. So yeah, we'll all work together on this. We'll stay close to what the data look like and how things are progressing. And when it's safe, then it'll be a great celebration to get back together and praise God for what He's done during this time for us.
Well, that's really good news. Of course, our heart goes out to all the people that have been impacted by COVID-19, either directly or indirectly, economically, financially, or with physical health. But we are also excited about the prospect of this being over with, or at least over in stages, and seeing ourselves past the peak here in a few days, and also understanding that we are nowhere close to overrunning our healthcare capacity in this area. I think that, for me, is the most encouraging thing, that we are not anywhere near capacity with our ICU beds. I don't think we are with our ventilators either. Is that correct?
That's correct. Yeah, no, it's a real blessing. We've got everything we need right now.
And so if we can continue on this trajectory, continue to be vigilant with keeping the virus from spreading and following these practices with a carefully monitored, staged reopening over the next several weeks, then we should never see the same kind of devastation that has happened elsewhere. And we're very thankful for that. Thanks so much for sharing with us today. We really appreciate the good news and the positive projections for the future.
Happy to be with you, Adam. Thanks very much.